The world of viruses is vast and constantly evolving. Among these is the human metapneumovirus, or HMPV, a common respiratory virus that often flies under the radar. HMPV is a significant contributor to respiratory illnesses, particularly in young children and older adults. It can cause symptoms from mild colds to serious complications, like pneumonia. Understanding HMPV is crucial for protecting vulnerable populations. By increasing awareness and promoting preventative measures, we can combat HMPV. Human metapneumovirus, or HMPV, is a single-stranded RNA virus causing respiratory infections in humans and animals. Identified in 2001, HMPV targets the respiratory system, causing symptoms from mild colds to severe illnesses. It can lead to complications like pneumonia and respiratory failure, especially in young children and the elderly. Severity varies based on age, health conditions, and immune strength. HMPV infections often present with symptoms that mirror those of the common cold, making it challenging to differentiate based on clinical presentation alone. The incubation period, the time between exposure to the virus and the onset of symptoms, typically ranges from 3 to 6 days. Common symptoms include a runny nose, cough, sore throat, and fever. These symptoms usually develop gradually over a few days and may vary in severity from person to person. In some cases, HMPV infection can manifest with more severe symptoms, particularly in young children, older adults, and individuals with weakened immune systems. These symptoms may include difficulty breathing, wheezing, shortness of breath, and chest pain. If you or your child experience any of these symptoms, it is essential to seek medical attention promptly to prevent potential complications. Remember, timely diagnosis and appropriate medical care are crucial in managing HMPV infections and preventing severe outcomes. HMPV is highly contagious and spreads easily from person to person, primarily through respiratory droplets released into the air when an infected person coughs or sneezes. These droplets can travel up to 6 feet and infect individuals who inhale them. The virus can also spread through direct contact with contaminated surfaces, such as toys, doorknobs, and countertops. Touching a contaminated surface and then touching your eyes, nose, or mouth can introduce the virus into your system. The virus can survive on surfaces for several hours, making it crucial to maintain good hygiene practices, such as frequent hand washing and disinfecting commonly touched surfaces, to break the chain of infection. People infected with HMPV are most contagious during the first few days of illness, when symptoms are most severe. However, it's important to note that the virus can still be spread for up to 2 weeks after symptoms subside. Section 5. Unraveling the mystery, diagnosing HMPV infections. Diagnosing HMPV infections can be challenging due to the similarity in symptoms with other respiratory illnesses. To accurately diagnose HMPV, healthcare providers rely on a combination of clinical evaluation and laboratory testing. During the clinical evaluation, the doctor will ask about the patient's symptoms, medical history, and potential exposure to sick individuals. They will also perform a physical exam, listening to the lungs for any abnormal sounds and checking for other signs of infection. Laboratory testing is essential to confirm the diagnosis of HMPV infection. The most common method is a nasal swab, where a healthcare provider inserts a long, thin swab into the nose to collect a sample of respiratory secretions. This sample is then sent to a laboratory for analysis. Other diagnostic tests include blood tests, which can detect antibodies produced by the body in response to HMPV infection. Section 6. Navigating the treatment landscape, managing HMPV symptoms. Currently, there is no specific antiviral treatment for HMPV infection. Treatment primarily focuses on alleviating symptoms and supporting the body's natural healing process. Rest is crucial to allow the body to fight off the infection. Over-the-counter pain relievers and fever reducers such as acetaminophen or ibuprofen can help manage fever and discomfort. Adequate hydration is essential to thin mucus and prevent dehydration. Encourage your child to drink plenty of fluids, such as water, clear broth, or electrolyte solutions. For infants and young children, a cool mist humidifier can help loosen mucus and ease congestion. In some cases, doctors may prescribe bronchodilators, which are medications that help open up the airways and improve breathing. Section 7. Shielding ourselves, preventive measures against HMPV. Preventing HMPV infections involves adopting simple, yet effective hygiene practices that can significantly reduce the risk of transmission. Regular hand washing with soap and water for at least 20 seconds, especially after coughing, sneezing, or blowing your nose, is paramount. If soap and water are not readily available, use an alcohol-based hand sanitizer containing at least 60% alcohol. Avoid close contact with individuals who are sick, and if you are sick, stay home to prevent spreading the virus to others. Cover your mouth and nose with a tissue or your elbow when you cough or sneeze to prevent the spread of respiratory droplets. Regularly clean and disinfect frequently touched surfaces such as toys, doorknobs, and countertops to minimize the risk of transmission through contaminated objects. Section 8. Understanding HMPV, the importance of awareness and prevention. Human metapneumovirus, while often overlooked, is a common respiratory virus that can cause a range of illnesses, from mild cold-like symptoms to more severe respiratory infections. Understanding the virus, its modes of transmission, and preventive measures is crucial to protecting ourselves and our communities. By adopting simple hygiene practices, such as regular hand washing and avoiding close contact with sick individuals, we can significantly reduce the spread of HMPV. While there is no specific treatment for HMPV, most cases resolve independently with supportive care, such as rest, fluids, and over-the-counter medications to manage symptoms. However, it is essential to seek medical attention if symptoms worsen or persist, especially in young children, older adults, and individuals with weakened immune systems. By staying informed, practicing preventive measures, and seeking timely medical care when needed, we can effectively combat this common respiratory virus and safeguard the health